there's a lot of people that I see, like patients that are just like, well, like if you roll back to like the 90s, people be like, oh, the doctor says this or the hospital said this, or, it had this kind of high level of trust. Now that's kind of
Hmm.
gone. And I
Yeah.
almost see that medical spas in some ways are almost taking the point of like the beginning of a cash pay medical system, because you have medical spas not only doing, of course, aesthetic treatments, but now they're starting to do hormone treatments. They're starting to do regenerative treatments. They're doing, joint injections with, PRP. They're doing joint injections with allografts, et cetera. Doing headache treatments, which, are not available in mainstream medicine, that kind of thing. What is your opinion on the way that things are progressing in terms of having a med spa and maybe this new form of medicine where there are people that are like, hey, I'm willing to pay cash and I want to get my own treatment. And for a lot of people, especially what I've seen is nowadays, I've talked to a guy, I think he was in his about 45 and his wife was about the same age. And he told me that he was going to buy healthcare insurance from United Healthcare and he was going to pay some like almost $2,000 a month in premium. And after that, he would have a $12,000 deductible. Then after the $12,000 deductible, it would be 70-30 with him and United Healthcare. He'd be at 30% after that too. And I was just thinking like, that is insane. Like you're almost better off insuring yourself than going that route. And so I see more
Yeah.
and more people going to med spas being like, hey, I have an issue with whatever. Like I know a lot of med spas are doing even sexual health stuff too. How do you feel like are you seeing the same thing in your med spa? Do you kind of see like a trend that way?
I mean, I'm not into the point where I'm doing, like IV hydration and, weight loss and those kind of things that I would consider more medical. But I mean, 100%, like people would rather come to me and pay me money, somebody that they trust and they already know, to do these things and at least know. I mean, there's a lot to be said for just being able to see the same, like one of even like two or three people every time instead of like the high turnover. You have no idea who you're going to see. They don't know you from anybody else. I mean, I personally haven't seen that just because I don't offer all of those therapies, but I definitely have the clientele that if they wanted something like that, like they would much rather come to a local business with somebody that they know, like me, as opposed to going into a hospital. I mean, I've actually had people reach out to me about doing Botox for migraines, but I haven't even learned that honestly, because I know you can, claim insurance for that and it's such a large amount, but now it's kind of making me wonder like if people actually would pay for that, like if they don't want to go through the hassle of paying insurance or they just don't want to go to some random person that they don't know to do these things. But I mean, I definitely wouldn't be surprised if it progressed more to that way. Like people are willing to pay a little bit more for luxury or for better experience. I mean, we all know going to the doctor, going to the hospital, addressing some of these things that might be embarrassing, like, right? Like people, I feel like will almost pay a higher price for an experience, to have the best possible experience, especially if they're dealing with, certain things that they might not be comfortable with.
Yeah, and I think now with you always hear that doctors hate when you go in there and you're like, well, I like what is going on with me, and they say XYZ, and they're like, well, I've been on the Google machine and it's saying like blah blah blah. Well, that's definitely true to a certain extent, but like doctors, nurses, they don't know everything, but there's alternatives to all of these things that people are now getting the option to actually do their own research and see what's right for them. And there's efficacy in in all these treatments, and it's not just some sham of or scam. It's an actual advancement in technology, and they have these other options. They're not stuck with the hospital anymore. And having them actually learn that, and I do think it's just going to keep on growing and growing as more and more people and become more mainstream as well.
I think you're 100% right. And that's what I see. I've had people come in for everything from sexual issues like erectile dysfunction to hormone things. And it's coming to a point now where I will even have people that will schedule consultations and pay for it just to get medical advice for their other doctors. Like, they're part of like, whatever, Kaiser Permanente or, United Healthcare or whatever, right? And they're like, hey, I just need somebody to explain to me, like, are these guys doing what's in my best interest? Because there's that much distrust in mainstream medicine now.